Hi everyone, welcome back to the channel. I'm Prajakta, a registered dietitian and gut health specialist. And today we are diving into a topic that so many people don't even realize is affecting their health: oxalate toxicity. If you have been dealing with things like kidney stones, joint pain, stubborn digestive issues, random skin irritation, fatigue, or even weird neurological symptoms that no one can explain, oxalates might be the part of your story. And do you know the biggest twist to it? Oxalate toxicity is strongly linked to gut health, especially leaky gut and gut dysbiosis. So, today we are going to talk about what oxalates are, how they affect your body, some common symptoms most people overlook, their connection with leaky gut, who is at risk for oxalate toxicity, what are some testing options available, and practical, sustainable ways to lower oxalates safely. So let's get into it. What are oxalates? Oxalates or oxalic acid are naturally occurring compounds found in many plant foods. Think of foods such as spinach, almonds, beets, sweet potatoes, cocoa, raspberry, turmeric, potatoes, leafy vegetable called Swiss chard, chia seeds, figs, and even things like lentils and quinoa. Your liver also produces some oxalate naturally. So, yes, oxalates are normal. They are not bad. But they become a problem when the levels get too high in your body. And that's when we run into what we call it as oxalate toxicity. What is oxalate toxicity? Oxalate toxicity may occur when the body is unable to break down, metabolize, or eliminate oxalates efficiently. This can happen because of consuming a diet that is high in oxalates. It could be because of poor gut health, genetic predispositions, kidney dysfunction, low levels of bacteria, degrading oxalate, or even sudden changes in your diet, such as going from zero greens to daily green smoothies. When oxalates build up in the body, they bind to minerals, especially calcium, and form sharp crystals. These crystals act like a tiny shards of glass in your tissues. And depending on where they accumulate, the symptoms can look very different. Now, let's see what are some of the symptoms of oxalate toxicity. I am going to list the most common ones that I see clinically in my practice. Number one, that we all know of, is kidney stones. Probably the symptoms that everybody knows. The most common type of kidney stone is a calcium oxalate stone. They can cause severe back or abdominal pain, blood in your urine, burning sensation while urinating, and frequent urgencies. Number two is chronic joint pain. Oxalates can lodge in the joints and mimic arthritis. People often describe that as stiff fingers, achy hips, pain in the toes or in your knees, and swelling and inflammation. Number three is digestive issues. This one is definitely big. Oxalates can irritate the gut lining and can cause many symptoms such as bloating, gas, constipation or diarrhea, nausea, and some stomach cramps. Number four is fatigue or low energy. High oxalate can interfere with energy production inside your cells, so fatigue, brain fog, and just feeling tired all the time are very common. Number 5 is nerve symptoms. This one surprises a lot of people. Oxalates affect nerve tissues and result in tingling. It can result in numbness, burning sensations, and even muscle weakness. Number 6 is skin problems. Some people develop rashes, itching, general skin irritation, even crystals like deposits on the skin, although this is a rare, but that do occur. Number 7 is urination or UTI like symptoms. Even when urine cultures come back negative, you can still have burning sensation. Number 8 is oxalate dumping. This happens when the body starts releasing stored oxalates too quickly, and symptoms may include headaches, joint pain, brain fog, nausea, itching of the skin, fatigue, or feeling tired all the time. The tricky part is that the dumping often happens when suddenly people cut out all the high oxalate foods at one time, which is why slow, gradual change is the key. Now, how does gut health fit into all this? This is my favorite part to talk about because it explains why so many people develop oxalate issues in the first place. A healthy gut lining works like a selective barrier. It absorbs nutrients and keeps the bad stuff out. But when you are dealing with leaky gut, those tight junctions in your intestinal wall get loosened up. Now, oxalates and many other things pass through it easily into your bloodstream. Two big reasons oxalates escalate when you have leaky gut. Number one, increased absorption. A damaged gut lining absorbs more oxalate than it should. These crystals act like sandpaper, creating more irritation, more inflammation, and thus worsening your leaky gut. So it becomes a vicious cycle. Number two is loss of oxalate, degrading bacteria. Yes, actually, we have bacteria in the gut that consume oxalates. One of the most famous ones includes Oxalobacter formigenes. And when the gut microbiome is disrupted, maybe because of excessive use of antibiotics, stress, infections, or poor diet, these little helpers actually disappear. And without them, oxalate breakdown drops and levels increase. Inflammation plus gut dysbiosis equals higher oxalates. Chronic inflammation associated with leaky gut also involves impairment in how efficiently your body metabolizes and eliminates oxalates. Therefore, for any client with oxalate toxicity, I also assess their gut health. Now, let's talk about who is most at risk for oxalate toxicity. Individuals who may have hard time with oxalates include those with kidney disease or previous kidney stones. Anyone with digestive issues such as IBS, Crohn's disease, or celiac individuals following a very high oxalate diet, such as smoothies with spinach, almond butter, and berries all the time. Individuals with dysbiosis or low levels of oxalate degrading bacteria. People with genetic disorders of oxalate metabolism, and even those who megadose vitamin C because of surplus vitamin C oxidizes into oxalates. Now, how do you test for oxalate toxicity? There are few ways. Number one is 24-hour urine oxalate test. This measures how much oxalate you are excreting. Number two is blood oxalate levels. more common in suspected severe cases. Number three is kidney stone analysis. If a person has passed a kidney stone, analysis of its composition may provide some clues. Number four is genetic testing. This is very helpful in cases we suspect inherited problems with oxalate metabolism. Now, let's talk about what most people care about, what you can actually do. How do you lower your oxalate levels safely? Now, here are most powerful techniques. Number one is limit high oxalate foods, but remember to do it gradually. You can just take out unnecessary items. You don't need to eliminate everything completely. Just decrease the large contributors such as spinach, almond, almond butter, almond flour, beets, sweet potatoes, cocoa, rhubarb, and replace them with low oxalate food options such as romaine lettuce, zucchini, cauliflower, broccoli, cabbage, pasture raised proteins, and once more, change should be gradually happening to avoid oxalate dumping. Number two is pair oxalates with calcium. It binds the oxalates in the gut to allow safe excretion of them from the body. Good choices to pair are dairy products, fortified non dairy milk, canned salmon or sardines with bones, some leafy greens or calcium supplements with meals only. Number three is hydrate well. Hydration helps dilute the urine and flush oxalates before they can crystallize. Number four is support gut health, and this is huge. You can support your microbiome with good quality probiotics, especially lactobacillus and bifidobacterium probiotics. You can use prebiotic foods in your diet, good quality fiber, fermented foods, and when possible, restoration of oxalate degrading bacteria. Number five is don't overdo vitamin C. Follow the recommended daily allowance unless instructed otherwise. Number six is lemon water. Citrate prevents the formation of crystals of oxalate. A simple lemon water every day can be very, very supportive. Number seven is address any underlying issues if you have Crohn's disease, irritable bowel syndrome, celiac disease, chronic gut infections, and working on gut repair can actually greatly reduce oxalate absorption. Number eight is test and customize. You don't need to guess. Working with someone who understands oxalates, gut health, and mineral balance, such as a registered dietitian, can help you create a plan that is safe and sustainable. Final thoughts. Final thoughts for this video. Oxalates aren't the enemy. They are found in healthy foods, and most people tolerate them just fine. But if your gut isn't functioning optimally, or if your detox pathways, kidneys, or microbiome are compromised, oxalates can become a hidden driver of symptoms you have been struggling with for years. But the good news is you can decrease oxalates naturally, reduce your symptoms, and feel normal in your body with the right approach, in particular for healing. If you found this helpful, like this video, subscribe, and share it with someone who's been dealing with these mystery symptoms. And if you want more support with gut health or mineral testing, including the hair tissue mineral analysis, check the links below. By the way, I'm running specials for HTMA test for this holiday season. Check out the details. Thank you for watching, and I will see you in my next video.